We know that there are significant side effects associated with many of the spine surgeries that we do today. In my practice at Orthopedic San Antonio, I'm a huge advocate of avoiding fusion if at all possible. To do that, we've implemented multiple new technologies. Minimally invasive decompression surgery, where we use a high-powered microscope and small tubes or small cameras to make small incisions in patients where nerves are pinched or where the spinal cord is pinched. And using a high-speed burs that spin at 80,000 revolutions per minute, you're able to, in a very surgical, minimally invasive way, remove large bone spurs, large pieces of hypertrophic, thickened fibrous tissue that are pinching the nerves. There's other technologies that I'm a huge advocate of, cervical and lumbar disc replacement technology, where instead of doing a fusion with a cage and screws, you remove the degenerated disc and you replace that disc with an artificial joint that allows you to bend and extend and move and rotate. And that, I think, allows you to treat pain without the debilitating side effects of the stiffness and loss of range of motion from fusion. That is one of our key strategies here at Ortho San Antonio.